Evaluate the use of vaccination programs in the prevention of disease in society. Firstly, I pose the question, what is a vaccine? It is defined as any preparation used as a preventative inoculation to confer immunity against a specific disease, usually employing an innocuous form of the disease agent as killed or weakened bacteria or viruses to stimulate antibody production. This means that a vaccine is a weakened form of a bacteria or virus which helps to inoculate and arm the body against future strains of the disease that are not weakened. Now, how does a vaccine work? When an antigen enters your body for the first time, we respond by producing lymphocytes, which is a type of white blood cell. The two main types of these lymphocytes are T and B cells. The T cells form in the bone marrow and develop in the thymus gland. When a T cell comes into contact with an antigen, it becomes active and starts to make clones of itself. B cells also form in the bone marrow but control the humoral response. They also activate in the blood and lymph when in the presence of an antigen. When activated, the B cells clone themselves and split into plasma cells which release antibodies into the blood, or they become memory cells. The antibodies are made and then go on to attack the antigen and leave them to be harmless. When you are given a vaccine, the weakened strain of the disease enters your body. The white blood cells, or T and B cells, release the antibodies that attack the antigen. By doing this, the B cells leave behind memory cells once the antigens have been destroyed. These memory cells hold the information to fight that specific disease that you have been vaccinated against and stay there in case the body is ever exposed to that disease again. By having these memory cells, it helps the body to more efficiently kill the disease within the body, and if a harsher or stronger strain of the disease comes into contact with the body. Public vaccination programs have both controlled and prevented disease through vaccination. We've done this by slowly immunizing people against disease. By doing this, the disease can slowly be eradicated as more and more people become immune to it. When there is an epidemic or pandemic, the use of vaccines enables the world to inhibit the spread of the disease. The effect of these programs is that it helps people to become immune in the case of an epidemic or pandemic, and it also slows the pace that the disease is spreading. Currently, as both children and adults, we are vaccinated against many diseases. By vaccinating so many people from a young age, it stops large amounts of people getting the disease later in life. This large-scale immunization that takes place helps to prevent an epidemic from breaking out. Although, vaccination is harder to get access to and is less common in third world countries as the people cannot afford routine immunization or health service. This explains the high rate of disease and illness within these countries because of the low rate of immunization. Vaccines also protect the people who are not able to get vaccinations. For example, if a person is unable to receive a vaccine because they have a very low immune system, then the people around them who are vaccinated won't be able to pass the disease onto this person. This is called herd immunity. The people around the person with a low immune system form an indirect form of protection for the person without the vaccine. It also makes very little chance for there to be an outbreak. However, herd immunity can only work if everyone who is able to receives the vaccination. Vaccination programs have shown to be very effective. For example, this is seen in diseases such as diphtheria, polio, and smallpox. Diphtheria is a bacterial infection that results in a membrane that forms in the back of the throat or nose that makes breathing and swallowing difficult. The vaccination for diphtheria has become a very important vaccine as it has helped to minimize the amount of infected people all around the world. During the first half of the 19th century, it caused more deaths than any other infectious disease in the world, but because of vaccinations against diphtheria, the amount of people to contract the disease has gone from 23,199 reported cases in 1921 to being almost eradicated in Australia with only small outbreaks in other countries. Over the past 50 years, the fatality rate has gone from being over half of people infected to only a 5 to 10% fatality rate. This rapid decline in cases of diphtheria shows just how effective the vaccination program is. Polio is another infectious disease. If it invades the nervous system, it can cause paralysis, and in its worst case, it can be fatal. Up until the 1960s, polio was an extremely common disease. The decline in cases in the 1960s is due to the creation of the injection and oral polio vaccine. Many different vaccines have been made and improved over time, but in 1953 a vaccine was created by Jonas Salk and a mass vaccination program in Australia began in 1956, leading to the rapid decline of reported cases of polio. In 1966, the Salk vaccine was replaced with an oral vaccine, although over time it was found that a small number of people taking the vaccine would contract polio from the vaccine itself. Finally, in 2005, an inactive polio vaccine that is given by injection was created to take the place of the oral vaccine. Thanks to this, the last known case of polio in Australia due to the wild polio virus was in 1972. But in 2000, the entire Western Pacific region was affirmed to be free of the polio virus. Although, once again, just like diphtheria, other countries still struggle with the polio virus, and thus a traveller in 2007 returned home to Australia infected with the virus. According to the World Health Organization, 99% of polio cases worldwide have diminished since 1988. An estimated 350,000 cases of polio have decreased to 74 reported cases in 2015. This extreme decrease in infected polio patients shows that vaccinations are slowly preventing and controlling the spread of disease. Smallpox is an infectious disease that is caused by the variola virus. The virus is transmitted from person to person through prolonged and direct face-to-face contact. Direct contact with contaminated fluids, direct contact with contaminated objects, especially contaminated beds and clothing, and it is rarely transmitted by air except in confined spaces such as trains or buses. Smallpox is most dangerous when the rash starts to appear and continues to be contagious until the last rash falls off. Smallpox is a large virus and therefore needs to have more strategy than smaller viruses when trying to avoid the immune system. The virus is coded in a special protein code which helps to reduce the likelihood of detection. The major symptoms that come from smallpox include fever and pus-filled lesions or pustules that form scabs and eventually drop off. Smallpox is the only disease to be eradicated from the world. It was estimated in the 18th century that the disease had killed approximately 400,000 people per year. But in 1976, Edward Jenner created a vaccine from a similar virus called cowpox. This vaccine was administered to everyone in Australia until 1938, and from then on it was only given to people who were considered more at risk of contracting the disease. But at the same time, around 50 million people still suffered from smallpox each year in other countries. In 1967, the World Health Organization started a campaign to eradicate smallpox from the world. And by 1979, the World Health Organization declared smallpox to be the first disease to be eradicated from our world. This disease went from being one of the most deadly and infectious diseases in the world to becoming a disease that no longer requires a vaccine. This displays just how effective vaccines are and how they can control, prevent, and end disease.